Today we are going to talk about pulmonary medications. We are going to briefly discuss how the medications work, and then we are going to talk about how to take them appropriately. We're only going to talk about the most common types of medications because there's so many different pulmonary medications out there. So if you have questions on your specific medications, feel free to ask. The first one we're going to talk about is short-acting bronchodilators. So these work by relaxing that smooth muscle around your airway. So we had talked previously that your airway is surrounded by smooth muscle. When you become exposed to an irritant, that smooth muscle is going to contract down. And these medications, these short-acting bronchodilators, open that smooth muscle up. So the way these, these are going to take about 15 to 20 minutes to take full effect, and then they will wear off within a few hours. You're always going to want to make sure you have this with you at all times so that if you're ever have a bronchoconstriction, you always have it available and you can take it as soon as possible. You also can pre-treat with this medication. So if you know what your irritants are, 15 to 20 minutes before you expose yourself to that, you can take this medication to help prevent a bronchoconstriction or an asthma style attack. The next one we're going to talk about is long-acting bronchodilators. So these are they work the exact same way as the short-acting bronchodilators. They just take longer to kick in. So they take about 1 to 2 hours to take full effect, and then they usually wear off between 12 and 24 hours, depending on the medication. So these are usually maintenance medications, and you're going to take them one to two times a day, depending on your prescription. But they work in the exact same way. Then there's inhaled corticosteroids. So inhaled corticosteroids work the same as an oral steroid. They're just directed at the lung. So what they do is reduce inflammation, and it's more targeted to the lung. So if you're either your airway is inflamed and smaller, tightened down, it reduces that inflammation, or if the distance between the alveoli and the blood vessel is inflamed, it can reduce that inflammation. So depending on your disease process, you may be on an inhaled steroid long term. And then there's anticholinergics, and the anticholinergics are meant to reduce your mucus production, and they also are going to help thin out those secretions. So similar to Mucinex, they work very similarly. They're just prescription medications. With these medications and Mucinex, the key to them is you have to be adequately hydrated. If you are not hydrated or dehydrated even just a little bit, your body's not going to be able to give up any water. And the way these work are by pulling water from your system to hydrate those secretions, to thin them out so that they're easier to get out. So if you've ever taken and it hasn't worked, more than likely it's because you weren't appropriately hydrated. So definitely make sure you're drinking lots of water whenever you're going to take these medications. And then there are combination medications. So on your handout, you'll see a couple of the combination. These are just combinations of the ones we've talked about. So any form of combination, long-term bronchodilator with an anticholinergic, you can have all three of those combined, whatever it may be. These are beneficial for a couple reasons. One, the less medications patients have to take, the more likely they are to be compliant with their medications and actually take them. And then also because the medications, it's a little bit cheaper usually with insurance. So instead of paying for 3 different medications, you're just paying for the one medication. So generally there's a lower copay because you're just paying one copay on those. The key reminders or things to remember with pulmonary medications is, one, you need to make sure you're sticking to a schedule and take these medications on time as often as possible. So these medications wear off a lot quicker than an oral medication. And the reason for that is they're directly going into your bloodstream. So your lungs are a direct link to your bloodstream, which is why they're a much lower dose and why they wear off so much faster. So when we take a medication orally, it has to be broken down by our stomach acid, go through our stomach lining, get absorbed into the bloodstream, and then it goes through the liver and gets filtered a little bit before it gets into our system. When you inhale medications, it goes straight into the bloodstream and starts circulating. It doesn't go through the liver for a while. So they do wear off pretty quickly. They usually have, for maintenance medications, usually have about a 12 to 24 hour wear off time. So if you make sure you're taking them at the same time every day, you're going to get the most benefit. If you forgot to take your medications and you do have a rescue inhaler or one of those short-acting bronchodilators, I recommend that you take that first, wait 20 minutes, and then take your medications. Because that's going to help open up your airway so the rest of your medications can get in and all the way deep down into the bases of your lungs. Other thing to remember is you need to rinse and spit. So rinse out your mouth after every pulmonary medication. I recommend you do every pulmonary medication because most patients don't realize they're on a steroid. If they are on one, especially if it's a combination medication, they may not realize there's a steroid in there. And the steroids specifically you need to rinse and spit with, because if they're left in your mouth for too long, they can cause thrush. And nobody wants that. And then the last thing is, if you're on a medication in any of these groups and it's not working for you, you need to talk to your doctor, because each of these medications generally have a base. So in each category, they have a base medication, which is the same, but the difference between them is carrier medications. And the reason this is different is because brands or manufacturers can't copy directly over because of copyright laws. So they have to change it just a little bit. And what they change is not that base medication, they change those carrier medications. And those medications are what help get it into your system where it needs to go. So if you feel like your medication isn't working, it could be because those carriers are not working in your system, because everybody's body works a little bit differently. We all have different hormone levels, and everything just responds differently, kind of like allergies. Everybody has a different allergy. So I recommend you try a different one in that category and talk to your doctor to work on different ones. If you are having issues with one of your combination medications and you've tried different in that category, you can try to split those medications out and see if that helps a little bit better. But just make sure you're working with your doctor on trying different ones, because it's not necessarily that pulmonary medications just don't work for you. It may be that that brand doesn't work for you. Okay, so proper ways to take your medications. I'm going to grab my bucket here. So the way we take our medications is different for each thing. So this is a nebulizer. Sorry, it almost fell. This is a nebulizer, and this is usually used with a liquid medication. So this right here. So these vials. So this should be rinsed out after every breathing treatment or when you're done with your series of breathing treatments. And the reason for that is your medications are really sticky. And this piece right here is what creates the mist from a liquid and what nebulizes it. If this piece gets stuck in here, it's not going to nebulize. If this piece goes missing, it's not going to nebulize. So you want to make sure you rinse these out after when you're done with all of your breathing treatments. And you rinse the whole thing, set it to air dry with a clean towel or a clean paper cloth over top of it. And then to use it correctly, once it's all put together, we are going to take this off, and we're just going to empty our vial in this way. And the reason for this is a direct link to your respiratory system. So if you put this in here, or if we open this all the way up, it's being exposed to more germs, and we're more likely to touch it with the edge of this. And there's germs on this, there's germs in the air. So the more we can limit that by just keeping this closed and squeezing above it, after it's all clean is going to be more beneficial because you're less likely to get sick when you're taking your medications. And then this just pushes back on top. There's an air hose that connects, and then you're just going to breathe on this. So what I tell patients is this does not leave your mouth as long as it's nebulizing. And the reason for that is if it's down here, we're not getting any medication. We don't have lungs down here. So you need to keep it in your mouth, breathe in and out. Also, this corrugated tubing does help collect some of that medication. So you rebreathe some of that in when you take a breath back in. If it's starting to make a sound or you think it might be empty, just tap it. It'll drop some of those droplets back to the bottom so their medication continues. And then every 4 to 5 breaths, you're going to take a deep breath in, hold for 10 seconds, slow exhale. And that's just to make sure that medication gets all the way into the bases of our lungs. The next one we're going to talk about is an MDI. So that's what this looks like. These are your quick-acting bronchodilators. And with these, they are a fast mist. So it's really quick out of here. There's 2 ways to take this that are preferred. The best way is going to be with a spacer. So this is an aero chamber. There's all kinds of spacers. This is the most common. But if you talk to your doctor and ask for a spacer for your inhaler, they'll know what you're talking about. You do have to have a prescription through the pharmacy to get one. But you're going to put it in here, and this helps in multiple ways. One, it helps with hand breathing coordination. It also helps reduce what we call static with your medication. So you actually get more of that medication. And it also helps to not just get it into the back of our throat, but actually deep into our lungs. So the way this is going to work is you're going to spray here, and then we will take this off. There's a one-way valve. You're going to take a slow, deep breath in. Okay, so this is slow, deep breath. So it's a. This also helps because if you go too fast, it'll whistle at you and let you know that you're breathing too fast. So slow, deep breath in, slow exhale, and then wait 30 seconds before you take another breath. And you want to do a 10-second breath hold. So slow in, hold for 10 seconds, slow exhale, wait 30 seconds to a minute before you take your next breath. If you can't get a very deep breath, I recommend you do 2 breaths on this for every puff of medication, okay? And you're going to keep this in here until you're completely done, and then you can take it out. This gets rinsed out regularly. This, if you haven't used it in a while, or if you haven't ever used it before, if it's brand new, you need to prime the chamber by doing 2 to 3 puffs into the air. So if it's been more than a couple weeks since you've used it, or if it's a brand new one, and the reason for that is it's to prime the chamber. So this medication does dilute over time. That's down in here. So you want to prime that so you're getting the maximum amount of medication and the actual dosage that you should be getting. There's also short or slow mist. And this one twists, maybe. I'll grab a different one. Okay. So this one twists, and then when you push it, it has a slow exhale. This one doesn't have anything in it right now, but it slowly goes out. So this one you can put in your mouth and slow deep breath in, hold for 10 seconds, slow exhale. This one is preferred to not go in your mouth. So there is an open mouth technique, which is 2 fingers out. You're going to hold it away from your mouth like this. Open your mouth nice and wide. Make sure your tongue's flat. And you're going to push and breathe at the same time. So hold, exhale. So it follows that same 10-second hold, 30 seconds to a minute in between each breath. The reason for that is when you put it in your mouth, most of that medication just goes to the back of your throat, and you don't have anything that this medication can help with back there. So this needs to get into your lungs to function appropriately. The best way to do that is with the spacer. If that's not available, do the open mouth technique. Those are the two best ways. If you absolutely have to, you can put it in your mouth, but you're not going to get very much medication that way. So I highly recommend patients do not do that. If you have an issue with the coordination, you should definitely get a spacer. And then there is this, which is a discus. So these are your powdered medications. These are a quick, deep breath. So it's a, okay, if you can't do that and generate enough force, this medication is not going to work for you. So it should kind of rattle a little bit when you breathe on it to make sure you're getting a full breath in or going fast enough. So if those haven't worked for you, it could just be that you're not generating enough force. So definitely try that. If you're not able to generate that force, talk to your doctor about switching to a mist. So those are all of the medications or the way you can take your medications. Proper order is you're going to want to take your short-acting bronchodilator first if you do take one of those regularly, and then all of your medications after 20 minutes after your short-term or short-acting bronchodilator. Otherwise, you can just take them in any order that you want to. The last thing we're going to talk about is vaccinations. So the 3 vaccines that are recommended for pulmonary patients right now are the pneumonia vaccine, the flu vaccine every year, and then the COVID vaccine. Vaccines help to just give your body a blueprint to that illness so that if you do get sick, you're able to manage that a little bit better. Your body already knows what to do. It's already created a defense against that, and it can help with that to help minimize those symptoms and keep you out of the hospital. And with pulmonary disease, you're at a much higher risk of ending up in the hospital, even with just a cold. So with more serious illnesses, we definitely want to try to get a vaccine on board. But I recommend everybody talk to their physician because sometimes they don't want you to take a vaccine for certain reasons, for other health reasons. So you definitely should talk to them first before you do decide to take a vaccine. The pneumonia vaccine, there's 2. So the primary one came out quite a while ago, and then there's a newer one that has a bunch of different protection against it. It has newer strains that it's also protecting against. So if you're not sure which one you have, or if you need to get a new one, definitely talk to your physician. And then with the flu vaccine, that's every year. And a lot of people don't realize that there's 2 viruses out at the same time around flu season. So you have your influenza, which is what the flu vaccine protects against. And then you also have your norovirus. And that's the stomach bug that everybody thinks is the flu. So the vomiting, diarrhea, all of those things. That's the norovirus. The influenza is a upper respiratory infection. So sinuses, coughing, lots of secretions, all of those things. The flu vaccine does not protect against the norovirus. So even if you got your flu vaccine, you are very possibly or able to get at higher risk of getting that norovirus still. It doesn't give you any protection for that specific virus. So kind of just keep that in mind. And then the COVID vaccine, there are different types out there. They all work a different way. I would just recommend everybody talk to their physician and kind of see what their recommendation is and have an honest conversation with them and then trust what your doctor is telling you as the expert in that situation. Best ways to help prevent this is to wash your hands, wear your mask, socially distance. For all of these respiratory viruses, that's the best way to help mitigate you getting sick with all of these. If you have any questions, feel free to ask. Thank you.